It's no secret that Austinites love to eat out, and we have over 4,000 restaurants to prove it. Add to that all the festivals where food is sold and the mobile food vendors that offer everything from cupcakes to sushi, and that's a lot of food establishments. So who makes sure that those preparing and selling the food are doing so safely? It's the job of the Austin-Travis County Health and Human Services Department. Within the department, we have the Environmental Consumer Health Unit. Among their responsibilities are restaurant inspections. These include restaurants, grocery stores, bars, mobile vendors, food manufacturers, food warehouses, coffee bars, bakeries, convenience stores, some daycare facilities, and schools. I'm going to turn it over to Restaurant Sanitarian Mark Parsons to explain how the inspections are done, what sanitarians look for, and what a restaurant score means.
We're here today to kind of demonstrate what we do when we go to a restaurant to do an unscheduled routine health inspection. So we start today in this part of the kitchen where they've got the cook line and they've got the make line. Over here they have the cook line where the hot food is prepared. Over here is, call these a sandwich prep unit, where they keep the food ready to eat food that they prep and hand it out the window. So one of the first things we look at on a unit like this is the temperature of the food. The food has to be kept at 41 degrees or below to keep the temperature of the food from growing bacteria. So we get the thermometers out. The thermometers are calibrated once a day, sanitized between uses. They have the food covered, it's put up for the day, so this is good. We look at these food temperatures. It needs to keep the food at 41 degrees or less to keep bacteria from growing during a time when they're holding it for long periods of time like this. This temperature is good. It's at 41 degrees, so this shows that they've maintained the proper temperatures, so that's good on that unit. Next, we look below the unit to see how they're holding the food down here below the unit. The food's covered and protected. We look to see that there's a discard date on containers like this. It tells when it was made. They have a shelf life of 7 days for potentially hazardous food. This shows that they're adequately dating the food when it was made and put in there. So these foods are all properly covered and dated, discard dated. After checking the cold side, we turn our attention to the cooking side of it. We notice that the stoves over here are off. They've got a pan of bacon on the stove, but the bacon is crispy cooked, so it's no longer considered potentially hazardous, so the temperature is fine for the bacon. Move down the line, the grill's clean, hot. Nothing in here. These are oils. They don't have to be kept cold or hot. The cook line's good, the vent hood's good. No built up dirt in the corners. So then after we leave this unit, we go do other things in the kitchen. Like we'll check the walk-in cooler to see what the temperatures of the foods in the walk-in. Do they cool the food properly? Do they keep it covered? Do they keep it segregated? Raw foods are not above ready-to-eat foods. We look at things like the dishwasher. Is it properly sanitizing? Then we interview the staff to see what's their procedures on hand washing, for instance. That's a big one nowadays. You don't have to wear gloves in a restaurant to make food, but you have to have special hand washing procedures. Hands need to be washed for 20 seconds with soap and water, vigorously rubbed, dried off, double hand washing, and then they can use a hand sanitizer to touch ready-to-eat food, or they can use gloves, nail brushes. They have to document in writing their procedures for hand washing. They have to show us that all the employees have been trained and know how to properly wash their hands. We get to see behind the restaurant doors. If you notice anything in a restaurant, you can ask the management these kind of questions. What is your hand washing procedures? Or you can call 972-5600 and talk to a sanitarian if you notice a restaurant. We try to inspect a restaurant every 6 months, so we're not in there every day trying to follow them around. We do those things. We see that they're educated. They have a food manager. Then we spend a lot of time interviewing on all these procedures to see, do they have control of it? We go over it with the management to see what they're doing. We spend a lot of time doing that during an inspection of restaurant kitchens in Austin.
Mark Parsons adds that if no violations are found, the food establishment receives a score of 100. If more than 30 points are lost, a reinspection is required and corrections must be made to bring the score above 70 in accordance with the Texas Food Establishment rules. If subsequent inspections score below 70, compliance actions will be taken. Through education, training, and regulation, the Consumer Health Unit carries out a community-wide program in Austin and Travis County to promote health, safety, and prevent disease. This is a partnership with the people who make the day-to-day decisions that actually determine food safety, the operators and employees of food service establishments. And with a robust process and partnership in place, the more we can enjoy all the wonderful food this community has to offer. To find a restaurant score, visit our website at www.ci.austin.tx.us/health.